Good afternoon, and thanks for joining us virtually again today. I'm Dr. Martha Buchanan, Public Health Officer and Senior Director of the Knox County Health Department. It's Public Health Week, so today our moment of gratitude is dedicated to my staff and public health workers across the state, country, and the world. My team has been working long hours away from their families to keep the people of Knox County safe and healthy. I'm always proud to be part of this team, but especially during times like these. And I want to take a little moment to say thank you to also the folks who've sent thank you notes to my staff and to me personally. Really helps uplift us as we're working these long hours and missing time with our kids and our families. So thank you for that. I also want to thank Kroger Health and Knox County Health Department team members who facilitated this weekend's drive-through testing opportunity. Because of this, 262 additional individuals were able to be tested, ultimately giving us a better picture of the state of health in Knox County. We are working with partners to expand testing capacity within the healthcare community, and we will also continue to test people who qualify daily through a drive-through model when it works for the client at Knox County Health Department. Remember, to be tested at KCHD, you must first call our hotline and meet clinical guidelines. We are keeping track of the urgent cares and walk-in clinics that are doing testing. So if you have questions on where you can get tested, give us a call and we can help you find places to get tested. If you're not feeling well and think you might have COVID-19, we urge you to call your doctor's office. And remember, if you're having an emergency, a medical emergency of any kind, please utilize our emergency departments. It's important that they be used for emergencies, and but also important to remember that they are safe places to go when you're having a medical emergency. So don't hesitate to go if you really need to go to the hospital. Now we'd like to spend a few minutes talking about the Medical Surge and Alternate Care Site Task Force. This task force was convened by the Knox County Emergency Management Agency, KEMA, to look at the expected surge and includes KEMA, a representative from the area hospitals, public health, city and county officials. The task force is convened by KEMA, but it operates under a unified command, which is a collective approach used to develop strategies for multiple agencies in emergency situations such as this. They had their first meeting over the weekend, and we look forward to working with our partners and going forward toward common goals. Emergency preparedness with our hospital partners is a space we've long occupied, and we take this role very seriously. Moving to our local situation. We have 119 confirmed cases of COVID-19 in Knox County. 70 of those have recovered. 48 are active cases. 16 individuals have been hospitalized at some point during their illness. We have no additional deaths in Knox County due to complications of COVID-19 at this time. Here at KCHD, our epidemiology and emergency preparedness teams review various models each day regarding what we might expect to see as a surge in our community. So we as a community can better be prepared. Now that we have more than 100 cases in Knox County, the local analysis we can do is more meaningful. We look forward to sharing that data during our media briefings and on our website later this week. All of this underscores the importance of social distancing and adhering to the CDC's guidelines on wearing cloth and/or masks when applicable. On that point, the CDC released new guidelines recommending the public wear cloth face masks or cloth face coverings or homemade masks in public settings where social distancing might be a little more difficult. These would be places like the grocery store or the pharmacy. This is a change from the CDC's original guidance. However, in this arena, change is a good thing. This is a novel virus, and as the scientific community learns more, changes to the guidance are implemented. While change can be challenging, it demonstrates that we are learning more and more about this virus every day, which will help us better protect our communities. But once again, It's important to remember that masks cannot take the place of social distancing. And that I think also I'd like to say to the community that you wouldn't expect us to learn new things and not put those things in place to better protect you and our families and our community. So now I'll open it to questions.
Still waiting on questions. If you all have questions, go ahead and submit them now, please. All right, from WBIR, you addressed new CDC guidance on masks. Can you say explicitly, should people in Knox County be wearing masks and when? Are there types of materials that provide better protection for homemade masks?
So it's a great question. And if you go to the CDC's website, they have some really easy to follow instructions on how to make a mask at home and what materials you can use to do that with. So those materials are on there. And I would advise Knox County residents to follow CDC guidance. If you're going to a place, we all have to go to the grocery store, we have to get our groceries. You're going to a place where social distancing is a little bit harder than other places, wear a mask. This might help protect you and protect others as well. And you know, when we talk about social distancing, remember maintaining that 6 feet apart can be hard in an aisle when you're going down to the grocery store.
All right. WATE has asked how many people came through the mobile testing site at Zoo Knoxville Friday and Saturday?
We were able to test 262 people at the mobile testing site on Saturday.
From the Sentinel, any numbers on the quantity of PPE supplies collected at donation sites over the weekend?
That's a great question. The city of Knoxville was sponsoring those donation sites, I believe, the primary sponsor, and I don't have that data as of yet.
From WBIR, what did you speak about at the task force meeting over the weekend? What elements are outstanding?
So that's a really great question. I am actually not a member of the task force. Charity Menifee, our director of communicable and environmental disease and epidemic and emergency preparedness, is our representative on that task force. But I know they talked about planning and organizing, and they asked for some data from the hospitals.
From WATE, are we expecting a spike in cases this week or next? What are the latest models telling KCHD?
What we expect is for our cases to continue to rise and rise at a steady rate. What we hope not to see, and what we're asking all of you to help us reduce the risk of, is a sudden spike. Rising slowly over time, we expect that, and that's what we're talking about, flattening that curve. That sudden spike is what we're trying to avoid. And all of the measures that we've put in place, staying home, wearing masks, washing your hands, covering your cough, not going out if you're sick, not visiting people who are at higher risk, such as elderly folks, and accidentally making them ill. All of those things are going to help reduce the slope, make it smoother so that it doesn't spike up, that it just goes up slowly. And we expect cases to continue to go up.
From WBIR, any estimates on the portion of cases in our area that are caused by community spread?
Yeah, at this point, most of our cases are caused by community spread. We have, at this point, very few cases that are related to travel. People really aren't traveling very much. And that's, there are travel bans and other things preventing that, but also people making that choice not to travel to put themselves and their families at risk of getting COVID-19.
From WATE, talk about the Knoxville Expo Center. Who is running this new Expo Center hospital, and how many staff members are required to operate it?
Wow. So, so what we know now is that the Army Corps of Engineers has approved the Expo Center as a site for an alternative care site. And that process is kind of guided by the Army Corps of Engineers. The actual setting up and standing up, as we say it, of an actual facility and actually running it would be the decision of the task force, what that looks like, who runs it, how we staff it, how we put the furniture in there. All of those pieces have to be figured out by the local task force.
Okay. Any other questions? Go ahead and submit them into the chat box, please. Let's see. We are hearing, this is from WATE, we are hearing that some grocery store employees might be testing positive for COVID-19. Is that true? And if it is true, what are the guidelines for that store remaining open?
Right. So employees at various locations, not necessarily grocery stores, employees of different employers test positive, our staff works with those employers to implement the CDC guidance based on level of exposure and risk to the employees. So again, that's something our staff would work with those employers to guide them on what needs to be done or not done.
Any other questions? Go ahead and submit them in the chat box feature, please. All right. If there are no other questions, then we appreciate you all joining us. Thank you so much, and we will see you tomorrow at the same time.